Hello student, welcome to my channel. So today I have come with another topic of pharmacology, that is a prokinetic drug. So what are the prokinetic drug? They are the agent which is going to increase the peristaltic movement of the intestine so that gastric emptying and evacuation of the bowel may be achieved. What they are going to do? They are going to stimulate the GIT motility, increase the lower esophageal sphincter tone. So we can use this group of drug in gastroesophageal reflux disease. They are going to speed up the gastric emptying, so we can use it for the gastroparesis, like in diabetic gastroparesis. They are going to stimulate the small intestine, so we can use this one in the post-operative paralytic ileus. Then they are going to enhance the colonic transit, so we can use it for the constipation. Now, what are categories of drug comes under the prokinetic drug? We have four categories of the drug which comes under the prokinetic drug. One is D2 receptor antagonist. Then second one is we have a 5-HT4 agonist, motility receptor agonist, and cholecystokinin 1 receptor antagonist. Under the first category, we have 5 drugs like metoclopramide, domperidone, levosulfide, etopride, and cimetoprid. Under the 5-HT4 agonists, we have cisapride, mozapride, renzapride, zecopride, procallopride, and tagacerot. Then motility receptor agonist, this includes the macrolide like erythromycin, azithro, and clarithrol. Then cholecystokinin receptor antagonist, we have one drug, that is loxyglumide. So by looking at all these group of the drugs, this means all these neurotransmitter and the hormones, they are involved in the gut motility. Like dopamine receptor antagonists, they are going to act by dopamine neurotransmitter. This is going to act by the serotonin neurotransmitter. This with the motilin hormone, and this is with the cholecystokinin hormone. So all these four, they are involved in the gut motility. So let's take first what they do in the motility of the gut. What important role they play in the gut motility. So this is a gut. Here I have drawn the stomach followed by the duodenum. So in the gut there are two type of plexus. They are there. One is a submucosal plexus, which is beneath the mucosa. Their main action is they causes the secretion. And second one is we have meandric plexus, and this is in between the smooth muscles, like circular and longitudinal muscles, they are there in between another plexus, that is a meandric plexus, and their main action is they help in the motor activity of the gut. And here I have drawn one meandric motor neuron. So you can see here one meandric motor neuron. So this is the meandric motor neuron. So important neurotransmitter for the meandric motor neuron is ACH, acetylcholine. And this meandric motor neuron, it is going to make a synaptic connection with the another neuron, that is a dopaminergic neuron. So this is a dopaminergic neuron. Now dopamine that is released from this dopaminergic neuron, and it is going to act on the meandric motor neuron, on which D2 receptor, this D2 receptor, they are there. Now what are the action of this dopamine once it comes from the dopaminergic neuron? यहाँ से आकर ये जब इस receptor पे आकर लगेगी, what action it is going to perform? So this dopamine, it is going to exert mainly inhibitory action. So it is going to inhibit what? It is going to inhibit the release of acetylcholine, causes the gastric dilatation, relaxation of lower esophageal sphincter, and delays the gastric emptying. So all these action by inhibiting the release of ACH, it helps in the contraction and dilatation of the stomach, then relaxation of the lower esophageal sphincter. All that it is going to ultimately leads to delay in gastric emptying. Now, if we are going dopamine antagonistic drug, all action will be in opposite direction. So there will be this dopamine antagonistic drug, they are going to increase the release of acetylcholine, causes the gastric contraction, increase the tone of lower esophageal sphincter tone, and thus they are going to enhance the gastric emptying. So this is the first group of drug, that is G2 receptor antagonist. How they are going to help in a gastric motility, or what role they play in the as a prokinetic drug. Now coming to the second group of drug. Second one is your 5-HT4 agonist. Now what this 5-HT4 agonist, what they are going to do? Now this myenteric neuron, it is going to receive further connection from the two interneurons. So these are the interneuron, excitatory and inhibitory. E stands for excitatory and I stands for the inhibitory. So this is a interneuron, two interneuron, like one by the 5-HT4 receptor, which is going to cause the release of acetylcholine, this one, and through the 5-HT3 receptor, it is going to cause the release of NO, nitric oxide. So myenteric motor neuron, I again repeat, this myenteric motor neuron, this one, it is going to get the connection from the two interneuron. One is excitatory and another one is inhibitory by the 5-HT4 receptor and 5-HT3 receptor, and there will be release of acetylcholine and nitric oxide. This is the one which is going to cause the contraction of the proximal segment of the intestine or the gut, followed by the relaxation of the distal segments. And how these, they get stimulated, this 5-HT4 and 5-HT3? So they get stimulated whenever there is a mucosal stimulation of the gut. So with the mucosal stimulation of the gut, what happens? So this is a part of the gut, I focused here. There are various cells, glands and pits. One of the important cell, that is this bigger one, so which is shown here, that is this EC cell, that is enterochromaffin cell, in which 5-HT they are there, and this 5-HT that is released, and this 5-HT, it is further going to stimulate these receptor 5-HT4 and 5-HT3, and further they are going to rely on the myenteric motor neuron. Now the next one is, so this is about the two neurotransmitter, another important hormone, this is motility. This is the peptide hormone which is secreted by the upper GIT, and this acts on the receptor. Throughout the GIT there are motility receptor, and this motility, it acts on those receptor, and it is going to cause the contraction of the GIT, and it is going to increase the tone of the lower esophageal sphincter, and then it is going to enhance the gastric emptying, and it is going to enhance the contraction of whole gut, excluding the colon. So motility receptor agonist, like erythromycin, they are going to act in the same way just like a motility. So they bind with the motility receptor and exerts all that action. Now next one is cholecystokinin 1 receptor antagonist. Now how they are going to act? Cholecystokinin, it is also another hormone which is secreted by the upper GIT, and its main action is they are going to delay the gastric emptying, and when you are going to give the antagonist, it is going to enhance the gastric emptying. So now we have four group of the drug, 2 antagonists, this, and 2 agonists. So this is 5-HT4. This D2 already I have told. 5-HT4 agonist. Same thing, whatever I have told you, same thing I have written in the slide. By stimulating the 5-HT4 receptor in the GIT, there is a release of acetylcholine from the cholinergic myenteric neuron, which causes the contraction of the proximal segment. And thus enhance the movement of the food in the forward direction. High dose pe it is going to block the 5-HT3 receptor, and which has got the inhibitory influence. What it is going to cause? It is going to suppress the inhibitory transmission by inhibiting the release of N. So these are the 4 group of drugs. Among that, cholecystokinin, this is a loxyglumide. You just can remember the name of the drug. There is only one drug. It is going to enhance the gastric emptying. Motility receptor, there is again only one group, that is macrolide. Under that we have erythromycin, azithromycin and clarithromycin. I have already told how this group of drug they are going to act. Now 1 and 2, I will be taking up this D2 receptor antagonist and 5-HT4 agonist. Now D2 receptor antagonist, here comes metoclopramide, domperidone, levosulpride, etopride and cimetoprid. Now how this group of drug they act? Already I have told D2 receptor what they are going to do. Myenteric neuron, it is going to make a synapse with the dopaminergic neuron, and mainly it is going to exert the inhibitory influence. Once we give the antagonist, all the action will be reversed. So metoclopramide, it is going to exert 2 type of action, peripheral and central. Peripheral में it is going to block the D2 receptor. Apart from that, it is also 5-HT4 agonist, and at high dose it is 5-HT3 antagonist. So this is going to, by this it is going to exert the prokinetic action. Now metoclopramide, it has got the central action. Centrally also it is going to block D2 receptor and 5-HT3 receptor, which are present on the CTZ. So by this it is going to exert what? It is going to exert the antiemetic action. So metoclopramide, it has got the dual action, prokinetic as well as antiemetic action. Now coming to the second one is a domperidone. Now domperidone, this also acts both peripherally as well as centrally, but mainly it is going to block the D2 receptor both peripherally as well as centrally. Periphery में बेटा आपका जो myenteric neuron के साथ connection है वहाँ पे, so by blocking this it is going to exert the prokinetic effect, and centrally on the CTZ it is going to block the D2 receptor, so it is going to exert the antiemetic action. So this is also got the dual action. So levosulpride, it also act as the same way as domperidone. Now these 3 group of drug, metoclopramide and domperidone, they are going to have dual action. They have both prokinetic as well as antiemetic effect. ये याद रखना आपने. तो इसको antiemetic वाली क्लासिफिकेशन में भी हम डालते हैं और इसको हम prokinetic ड्रग की क्लासिफिकेशन में भी डालते हैं. So detail of these 3 drug already I have explained in my previous video. I will be giving a link in the description box. You can go and see it again if you haven't watched that video. Now coming to the remaining drug like etopride, cimetoprid and 5-HT4 agonists, cisapride, mosapride, renzapride. jacopride, prucalopride, and one more is there you cannot see on the screen, that is tagasivat. Right? So most of the drug they are ending with the pride, and here these two drug they come under D2 receptor antagonist, and rest of the drug they are 5-HT4 agonist. Right? Now what are the similarity between these group of drug? And the similarity between these group of drug is, number one, all of them they are benzamide derivative. Right? They are devoid of G2 receptor blocking action. Rather you can say in the center, centrally. There is no centrally D2 receptor blocking action which is seen by this group of drug. Whether it is this is going to block the D2 receptor, but it has got the peripheral action, not on the CTZ, etopride and cimetoprid. Though we are classifying this drug under this D2 receptor, but they are not going to block the central D2 receptor which are present on the where CTZ center. So that means the remaining drug, all the 5-HT4 agonists plus this etopride and cimetoprid, they come under, they are going to exert only the purely prokinetic effect. So they are not going to show any antiemetic effect. Now let's see the other remaining difference between among these drug 5-HT4 as well as etopride in the next slide. For 5-HT4 agonist, so similarity I have told, all of them they are benzamide derivative. They do not block the central D2 receptor in the CTZ. So they are purely prokinetic, no antiemetic action they are exerted by this group of drugs. So cisapride, it is a 5-HT4 agonist. ये पता लग गया. By this, what it is going to do? It is going to cause the release of acetylcholine. By that release of acetylcholine, there will be the contraction of the proximal segment of the gut and forward movement of the food will be there. That is what we want as a prokinetic drug. And weak 5-HT3 antagonistic action. So they are going to suppress the inhibitory action of NO. So this is further going to increase the movement, propulsive movement or peristaltic movement of the gut. ये तो बेटा इसके दो हो गए. Apart from that, it is going to increase the motility of gut throughout. What do you mean by throughout? Throughout का मतलब है including the colon. So this action, it is not seen with metoclopramide and domperidone. And how it is going to increase the motility of gut throughout the by increasing cyclic AMP dependent polaroid secretion in the colon. So this is going to cause what? Side effect इसकी वजह से क्या आ जाएगा? There will be loose stool. What else it is going to do? This cisapride, I am talking about the cisapride. It also blocks delayed rectified potassium channel in the heart. So by blocking this potassium channel, it is going to do what? It is going to cause a QT prolongation. Patient may go for the Torsades D pointis. This is the ECG finding. Another important pharmacokinetic feature is it is cytochrome P3A4 inhibitor. So important drug interaction, इसके साथ important drug interaction they are seen with this group of drug. Now what kind of drug interaction they are seen with this group of drug? Like with the azole, like ketoconazole, उसके साथ आती है इसकी drug interaction. Then we have a protease inhibitor, उसके साथ इसकी आ जाती है. Then we have a erythromycin group of drug. So we cannot give macrolides. We cannot give this drug along with the other enzyme inhibitor. Otherwise, what will happen? This also results in, if you are going to give that, QT prolongation. So this action and this action, these two action, what they are going to do? आपका ये वाला action, this and this, both of them, they are going to cause cardiac arrhythmia and patient may die. So this leads to cardiac arrhythmia and the patient may die. All these, the QT prolongation and all, there will be cardiac arrhythmia. So what is the current status of this drug? This drug, it is banned in all the country, including India also. Now coming to the next group of drug, that is mozapride. And another important thing is with the side effect, because mozapride, it is devoid of D2 receptor blocking action. D2 receptor को बेटा ये block नहीं करता CTZ में. So extrapyramidal side effect or side effect related with the gynecomastia, galactorrhea, they are not seen with the mozapride. Coming to the next one, this subsequent analog of the mozapride, mosapride, renzapride and zacopride. And their status is, they are almost same mechanism of action. The only thing is, and there is no pharmacokinetics. This is a big no-no. So no QT prolongation they are seen with this group of drug. Then next is the procalopride. This is the safest. So here no QT prolongation. So no drug interaction. This is the safest analog of mozapride, procalopride. And where we use it for the constipation. But still, though we say the safest analog, but still further studies they are required to prove all this, whether it is the safest analog or not. But there is again no drug interaction that is seen with this drug. Next is tagaserod. Mechanism of action of tagaserod, that is also the same, but this is not seen. This blocks the potassium channel and motility. But yes, tagaserod drug interaction they are seen even with this also, with the tagaserod. And it is used for the irritable bowel syndrome, constipation because of the irritable bowel syndrome, because here also drug interaction that is seen with the tagaserod like QT prolongation and all. So this drug, it is also banned. ये आपकी banned है, and this is also a banned drug. Now coming to the D2 receptor antagonists, now they are going to block the D2 receptor like etopride. ये कैसे काम करती है? It is not with the 5HT4. It is a D2 receptor periphery में, not the center. D2 receptor blocking action. Then another one is इसी का है, it has got anticholinesterase activity. Anticholinesterase activity means they are going to inhibit the action of cholinesterase enzyme, the enzyme which causes the hydrolysis of acetylcholine. So there is increase in the level of acetylcholine, and that is going to cause a contraction. So it has got the acetylcholine like action. So this way it is going to, and this is its mechanism of action. And another important thing is they are metabolized by flavin monooxygenases. No involvement of cytochrome P450. So there is no drug interaction they are seen with this group of drug. Cinetopride, this is also, there is no drug interaction that is seen with this. They are also same way, D2 receptor blocking action, plus a little bit they have 5HT4 agonistic action and little bit 5HT2 action that is also seen with this group of drug. And there is no drug interaction that is seen with this group of drug. And side effect, Sometimes because it is a D2 receptor antagonist, इसके साथ आपको galactoria and gynecomastia that can be seen, but that is also rare. So this is all about the prokinetic drug. Now what kind of question you may get in the exams? So in the exam you may get, one is short note. Short note you may get on the cisapride, mozapride and etopride. ये तीनों के तीनों important है. Then in the MCQ they may ask the banned drug. What are the banned drug out of this? So ये है बेटा आपका banned and why it is banned ये भी पता होना चाहिए. QT prolongation cardiac arrhythmia इसके साथ होता है, इसलिए इसको banned के status में डालते हैं. This is a banned drug. एंड इनमें से कौन सी है एंजाइम इनिबिटर? ये वो भी ये है सिजाप्राइड. इट इज अ साइटोक्रोम P3A4 inhibitor. So important drug interaction they are seen with this. Now etopride इसके साथ how it is metabolized by the फ्लेविन. इसके ये इसलिए इसमें बेटा सारे के सारे मैकेनिज्म ऑफ एक्शन आपने लिखने हैं. So that's all about the prokinetic drug. If you like the video, please subscribe my channel so that you can get the notification. See you in my next video.